even the gynecologists, they should also make it mandatory for their patients to get the oral health check done and the screening done and the cleaning done, because I think this is the longest time I haven't spoken to my friend because of some disagreement we had. I didn't speak with her for 5 months. Okay, for 5. Then she came back after about half an hour with the husband, and that husband created a whole lot of tantrum in the clinic that why was the consultation charged and why was the x-ray charged, and she doesn't need the treatment.
Welcome back to another episode of Raw and Real with Shikha. Today I have a guest. She is not just a dentist, she is a smile artist. From handling patient with care and managing life with grace, today on Raw and Real we have Dr. Munmun, a woman who wears many hats but never forgets to wear her smile. Let's go and deep dive in her journey. Let's welcome Munmun Dutta. Hi doctor, how are you?
Hi Shikha, it's such a pleasure to be here with you, and yes, I'm glad to be sharing my life journey with you in your podcast. And I'm a restorative dentist, general and restorative dentist with Emirates Hospitals Group, and I practice in 2 locations, in Emirates Specialty Hospital in Dubai Healthcare City and Apple Clinic, which is also a part of Emirates Healthcare Group. And I am practicing dentistry since over 18 years now, and in Dubai since 2006.
Great. Dr. Munmun, tell us, why did you choose dentistry as your profession?
Honestly, as a child, I never knew that I will become a dentist, but I always had this fascination to become a doctor, to wear that white coat, right? So, and biology was my favorite. So yes, one of those things. And I wanted to help others. I had this feeling of doing something for others, which drove me to becoming a doctor. And that's how I pursued dentistry. And there were no doctors in my whole bloodline, in my family. So that it was the thing that I always felt that, okay, I'm going to be the doctor in my family. There's nobody else. And that's how I chose dentistry.
Dentistry. I mean, is there any past good or bad experience you would like to share with us about your patient?
Yeah, there are so many good experiences. I mean, good experience, I can probably we can have a podcast telling you about all the good experience. Bad experience is very rare, but I think so. I had one weird experience which always makes me think about women. I mean, how they should be leading their life and how they should be taking care of their finances. There was a particular incident which really moved me. Was a woman came for a dental consultation to me, and we did the consultation, and I did an x-ray and I explained her everything that it's required to be done. And she said, okay, I'll go back home, I'll check with my husband, and then I'll come back for treatment. And she really needed that particular treatment. Right. Well, she came back after about half an hour with the husband, and that husband created a whole lot of tantrum in the clinic that why was the consultation charged and why was the x-ray charged, and she doesn't need the treatment. I'll go to my country, home country, wherever, and get it done. And I felt so bad for the poor woman that she was wanting to get the treatment done and she wasn't able to do it because she was financially dependent on the husband, and he was making the choice of also something, a treatment, medical treatment that she needed. And she took me aside and she told me that this is how it is in my house, and this is how the anger issues are there and this, so please can you just get the money returned, because otherwise I'll have to face issues. It went to a point where, because we had already billed in and all that, it went to a point when we had to call the cops and get the things settled. So that was I think one of the very bad experiences that I had, and which makes me always think that how important it is for a woman to be financially independent.
Yeah, and how about
good
the
experience?
good experience?
Oh my God, good experience. I have been super blessed to have my patients. They are like my extended family. From a recent experience, I'll just tell you about yesterday. There was a small child. This small must be her height. A very small child who was my patient, and she told me that, doctor, you're looking very cute today, can I take you home?
Oh, so sweet.
And I was like, okay, I'll go home with you. So will you cook for me? What will you cook for me? And she said, yeah, I will cook chicken for you, and I will cook rice for you. So these small incidences that happen in day-to-day life. And then there was an 84-year-old couple who came, and they literally, that was a first visit, and she said, I've had so many dental experiences, But after having met you, like now you have become my dentist. So these small things that I experience in everyday dentistry, then some patient going for a vacation and getting something, a small gesture, maybe some box of chocolate, or one patient also got me a sari from India. So these things, how the patients remembers what we have done in the past, and they don't need anything now. And one got water from me from Hajj. You know, so all these tiny things makes me really enjoy the everyday dentistry that I do. It's basically because of my patients. So incidences like this are so many that I cannot tell you. I'm very happy. That's the reason practicing dentistry.
I think you are surely blessed that you have such good patients who are coming back to you. Coming back to my next question, how do you balance your family life and work life experiences?
Okay, now balancing between family and work. I will be very honest with you. I will not say I'm 100% successful over here, because I don't know if I should put it this way, I'm a workaholic. I work 7 days a week. And somehow I feel that when you are so passionate about your work, and not just dentistry, I do events, I do many other things, somewhere a balance shift somebody has to, probably suffer a bit. And I feel I should be giving more time to my family than what I'm giving now. But consciously I make this effort. When I was not this busy, I never made a conscious effort to do this. But now I definitely make this conscious effort to spend an evening every week. Like I had the Sunday evening would be for my kids. We would go out, we would talk, they are teenagers, so like I'm a friend to them. So this is a conscious effort that I put. Somebody who probably suffers most over here because of my work schedule is my spouse. Yes, I think I do give him a little less time than I used to give before. But since his work schedule and my work schedule is so weird, he's a finance guy and he does trading, so he comes late in the night. So mostly we do spend time, quality time, which is not very a lot, but a little bit, but every day, which would probably be after midnight. And I feel that I should be giving, somebody whom I really need to give more time is to my parents, especially my father. My parents stay with me, and I think that is where I need to put more efforts to spend a little more time with my parents, because I feel that even when I go to the hospital and I meet my father and I sit with him for just probably 2-3 minutes and hug him, that gives him so much immense happiness. And you know what? He forgets. He's 85 years of age, and he forgets things. So when I come back in the night, sometimes he complains that you didn't meet me and go. So I think that is the place where I would like to put in more efforts to give more time to my family. But yes, I am definitely trying to balance this out as much as possible. The person who now in fact complain more are my friends. My friends mean a lot to me, and you would see my post, my Instagram, or all. I mean, you can understand what they mean to me. So earlier I used to give a lot of more time to them, but now they have kind of, after complaining for some duration of time, now they're like, okay, so fine, if it's a meeting, Munmun might not come. So if there are meetings planned, out of the 4 or 5 meetings, okay, the 5th one I might just go. So yeah, they are also the person I believe who need more of my time, and I need them to. Forget they need me, I need them to, because friendship is the biggest biohack I believe that we have.
Correct. So who is your support system?
Support system is my spouse, the first person whom I would say has encouraged me and pushed me to do whatever I want. I think without his support, I would not have been able to be here where I am. I wouldn't say that I am a victim or I have a sad story or my journey has been very rocky or something like that. No, but it has been a series of moments, series of incidents which has shaped me to become who I am today, whether it is ups and downs or walking through fire, storm, whatever, however metaphor you would want to use. But it has evolved me, made me to the person that whom I am, and I have never given up. And a push or a support that I have received during those times has been, of course, my husband's support. And I also feel that friends have played a very major role in my life.
They have played a vital role in
I
your
just
life,
think that biggest biohack in these times when people are suffering from anxiety, depression, loneliness, this, that, trying to take treatments, therapies and all that. Friendship is that one therapy that, is underrated. I
Correct.
believe. It's the biggest biohack. And it's not perfect. Friendships are also not perfect. You may get angry, get irritated, get upset with each other. But eventually it's how soon you get back to normal and resolve things and get back to normal. That is what I feel friendship is all about.
So you said about women's, like financial independence, financial
And coming to
freedom.
friendship, yes, one very important thing about friendship is women friendship. Now you also are a woman. You understand what women friendship means to us, and women actually are biologically also, they are high in oxytocin, and they they have more this empathy. That is why they have more emotion. They are they express themselves more, and their love is unconditional. So this female bonding, it kind of the bond releases that dopamine, which would probably, without the need for other things like taking a short trip or probably taking a shot of wine or hot chocolate or going to the treadmill. More than that, I feel it's the women friendship which is very, very valuable thing in any woman's life.
Would you like to share one experience where you felt that your friends are your lifeline?
Yes, I think a major event which emphasizes the importance of friends in my life is when my husband was diagnosed with cancer. And initially, yes, it's a jolting thing. You just don't know what to do. And that whole journey, the treatment journey and the initial diagnosis and all that, I think friends played a humongous role in my life. My childhood friends, they just called me up from India and they said that, come here, aa jao, yahan kara lete hain treatment, we'll do it here. Friends over here were enormous support, and even friends from back India, they were willing to come here. They said, okay, we'll all come. I have very close friends in here, childhood friends. So this, we'll just come here. So that saying itself, I think they putting up this words, it gives you a kind of an invisible strength that, okay, I can do it. I have the support system behind my back.
That's a moral support.
Yes. And those are the friends who are, rock solid friends. Now, friendship, we can divide it into 3 categories. There is leaves, there is branches, there is roots. Now, leaves are the ones, the seasonal friends who are there, you party with, you mingle with, you know them, you have nice time with them. That's it. You cannot be burdening them with anything more, right? And any storm comes in your life and it is withered away.
Yes.
The second variety, that is the branches, are the ones who are, yes, they are good friends, very good friends, but you cannot burden them with your problems. You can probably share something, but you cannot burden. Then comes those very close friends who are your roots, with whom you can just probably be yourself. They have seen you through ups and downs and they will sit in the mud with you, and it doesn't have to be a very long-term friendship. It doesn't, friendship is not about how many years. It is what you share. That sharing could be in a month's time, could be 20 years time. So I have very good, very close friends my childhood friends whom I have known from 30 years now, and I have very good friends now who I've probably known them from 6 months now, but I think I feel that strength of having them around.
Right.
That is what makes the whole difference. And a few incidences, if you ask me about friendship, then it's a beautiful thing to have this luxury of friendship, wherein sometimes we fight, you might be fighting with your friends also. Sometimes we fight, sometimes we don't speak, anger is there, irritation is there, everything is there. And recently, I think this is the longest time I haven't spoken to my friend because of some disagreement we had. I didn't speak with him for 5 months, okay, for 5 months. Okay. And that is the longest time I've ever been angry. And the good thing is that we have the common circle of friends, and we would know, I mean, that is the comfort level. We know, okay, acha, he's there, okay. Fine, I will talk. We know we are not talking, but we'll talk. And then his wife, my husband, they all know, acha, they are not talking, fine. And then one fine day, after 5 months, I decide to pick up the phone and call. Okay, yes, hi. And then I get to hear that, okay, I was waiting for your call. Oh. It was Navratri or sometime. It said, I prayed for it. And all my anger and everything just, kind of vanished. So those kind of friendships, that's rare. And then over here also, as I was telling you, that I have been so busy in the past 1 year that I have neglected my friends over here. So my very close friend here decided an event, an outing, and I told her from before, okay, I'm working, I cannot come. But one night before the event, she sends me a voice note. First she asked me, are you coming, Munmun? I said, see, I told you my appointments are already given, I will not be able to come. And then she sends me a voice note, and it's like an ultimatum. If you don't come, our friendship will end. And it was serious. It was not a joke. I immediately forward that voice note to my husband, and I say, now what to do? He was in some other city for some work-related matter. So he said, leave everything. Tell your reception. Just go for it. Don't upset her.
Yes.
Okay. So I did that. I exactly did that. In the middle of the night, 2:30, I wrote in my reception group that please check for my tomorrow's appointment and see if it can be rescheduled, because I need to give. I have to go somewhere. I have to give the time. So sometimes you really need to do these to your friends. It's how you probably give them back what they deserve. I think I can do more. Grateful is a very small word, but I try my ways to give that thank or gratitude back to my friends.
Of course, friendship ke bare mein, I think we can talk and talk a lot. It's a vast
topic altogether.
Going back to your professionalism,
yes,
going back to your dentistry, is there any difference between men and women oral health issues or needs?
Yeah. I'll tell you what, women has to take care about their health, especially married women when they are planning pregnancy or if they have already become pregnant. I think I make a lot of educative reels also in my Insta. I have put this also, that the hormonal changes that happen during pregnancy, the deposits in your mouth, the plaque and calculus, they react differently. And so there is a term called as pregnancy gingivitis, which is very common in women. And a lot of women you will see will tell them, then when I was pregnant, I developed cavities, I developed oral issues, I developed bleeding gums. They do not understand the importance of oral hygiene during pregnancy. And I think even the gynecologists, they should also make it mandatory for their patients to get the oral health check done and the screening done and the cleaning done, because the gum diseases, they also impact the pregnancy outcome. They can also lead to preterm birth or low birth weight child. So these things are very important, and there has to be this synergy and this understanding between the gynecologist and the dentist. So it is very important, yes, for women to maintain their oral hygiene. And systemically also, the oral health is, if you talk about men and women both, the oral health is related to so many systemic conditions, whether it is diabetes, whether it is heart diseases, rheumatoid arthritis, many other things. It is connected. So when we hold the mirror in the mouth, the hand which holds the mirror not just sees the teeth, it sees many other factors. We can understand what is going around in your body. It's a gateway to your body. So it is connected. The systemic health is connected to your oral health, and this needs to be emphasized. This needs to be known and made aware to everybody. That's what I feel.
So what are the top tips you would like to give to children and adults?
Oral health checkup, dental checkup once in a year should be done. If you cannot do it once in 6 months, then definitely once a year it should be done, because there are many things which are minor and which you would not notice. Generally in dentistry, a patient comes when there is a discomfort, when there is a pain. By the time the pain comes, it has already reached a level, a deeper level, where the treatment cost increases, the prognosis suffers. So a yearly check would always help the patient to understand, even when the pain is not there, we can point it out, okay, this is needed, it can be stopped then and there, the progression can be halted right at this place. So this check is very, very important, and I have seen nowadays people have of course become very aware. I've seen parents get their kids for the check and all, so which is very good. The awareness is increasing, but I still feel it has to reach more to the masses to take care of the oral health.
So if I have to ask you, how do you do root canal?
Root canal. Well, root canal is done to remove the infected pulp. Now, our teeth has got 3 layers. A tooth has got 3 layers: enamel, dentine and pulp. The progression of the disease or the cavity starts on the upper layer, the enamel. If you don't treat it at that time, it will go to the dentine. These are the 2 layers, initial layer of the dentine and the enamel, when the patient will not have any symptom. He can either only see the cavity, food lodgement would be there, nothing more than that. But if it is not addressed during this initial time, it will then travel to the third layer or come near to the third layer. That's when the patient experiences the sensitivity and the pain. And when it reaches the third layer, that's when we need to do the root canal. We have to remove that infected nerve, clean, disinfect the tooth and the root, and then fill it up and seal it to prevent further infection in that tooth. That's the stage it has gone to then.
Okay, so root canal has to be done again and again?
No,
or
it's
once
just done once, and then if it's a posterior tooth and if the tooth is damaged to quite a greater extent, then we ask the patient to put a crown or a cap on it to protect it and to use it for a longer time. And it is always better to save your own teeth. Now imagine if your knee gets hurt or if you get a fracture or something, you wouldn't amputate your leg, right? You would definitely treat it. Likewise, whether it is heart, whether it is knee, whether it is your tooth, if something is wrong, you treat it. You keep what you have, and that will always serve you better than an artificial tooth or a replacement to be put after extraction.
Right. So apart from dentistry, Dr. Munmun, you must be addressing a lot of patients. Like, you can talk about one anxiety issues, what your patients are facing.
Nowadays, the dental anxiety is there, needle anxiety is there, but usually I have come across, because we see so many patients these days, I feel this generation suffers a lot of anxieties, depression and all this factor because of two things, personal as well as professional. Things have drastically changed from how it used to be during our parents' time, and it's different for this generation. So I feel personal issues is there which reflects in their mouth. If a patient is depressed and if the patient is anxious, it reflects somewhere in their care, how they take care of themselves. So yeah, and these issues are there because nowadays there is a lot of things like people confuse curiosity to care. People confuse chemistry to consistency. They confuse conversation to connection. So there are people who are undergoing all these things, and they have to understand that if you're intense, if you're feeling, you are not wrong, you're probably in the wrong room. So these personal things is one thing which reflects upon them, and then of course the professional aspect is also there, where competition has increased, pressure is there, politics is there, and all these things. So everybody is affected in some way or the other, and people are fighting battles which we are not aware of. Maybe they are keeping a smiling face and we do not know who is facing what. So yes, I do see these things, and many a times we do interact with patient to that level when we understand that the background of what everybody is going through, and it makes us more empathetic basically, even for the treatment.
Rightly said. Is there any one go-to tip, like which my audience can take back from you?
I think we have to understand the luxuries of life. The luxuries of life is time, health, slow mornings, peaceful sleep, deep connections, family life, home cooked food, people to love and get that love back, and have people who love you back. These are the things which I think are the luxuries of life, which we must understand. And also I feel if anything you have lost in life, like we all have lost a lot of things in life, it always creates room for something else, something better which you probably need. And in life's battle, we must also understand that we cannot be changing people, whether it is relationships, whether it is friends. We cannot save human, but we can always love them and we can be there for them, meanwhile they save themselves.
Right.
So, and also one thing, that happy people radiate happiness. Hurtful people radiate hurt. But the quantum leap is taken by those people who have been hurt, but who choose to be better, not bitter, to be grateful, not hurtful, and they are the people who carry the sunshine, the light and the happiness around, and that's how I think we should all aim to be. And if you would ask me, I would pray for, I would want a little bit of foolishness to enjoy life, and probably a little bit of wisdom to make less errors.
Fantastic, Dr. Munmun. So would you like to give us one top tip about dentistry, about oral health?
Yes, I would like to say that it is dentistry which is not expensive. It is your negligence which is expensive. So you should be visiting your dentist once in a year at least and take care of your oral health with 2 times of brushing and if possible flossing your teeth.
So this was another episode of Raw and Real with Shikha, where Dr. Munmun shared her story, one tooth, one truth at a time. Thank you so much for watching Raw and Real with Shikha. Till then, see you. Bye.